Well, all right. Welcome, everyone. If you, as you're joining us, we'd love for you to join the chat and let us know what school you're coming from. And going to mix up a little bit. We'd love to know if you have attended one of our faculty workshops in the past few years or not. And there's a reason why we're asking that, but would love to see where y'all are joining us from today. And if you don't know what I'm talking about related to the workshop, sit tight. We will have that information for you in just a moment. Thanks, Joy, for starting the chat off. Appreciate it. All right, well, we will go ahead and get started, and we'll just keep having people join us as they come. Oh, we are all over the US. This is exciting. Well, welcome and thank you for joining us for our October webinar. We have monthly webinars focused on all different types of things palliative care education related. This month, we are super excited to do some faculty spotlights, really sharing with y'all some innovative works that faculty are doing at other schools of nursing throughout the country. The three speakers that we have joining us today attended our summer workshop this past summer at Portland, Oregon, and they presented posters related to the different teaching strategies or different things they'll be sharing with you today. And we were so inspired by what they shared that we wanted to learn more. And so we've asked them to join us this month to give us more details and to share with more individuals the great work that they're doing. So we welcome you to this. I'm Megan Lippy. My counterpart with all the LNEC School Nursing work is Dr. Andra Davis, and she'll be joining us in just a little bit. Next slide. We do always want to just acknowledge our funders. So Cambia Health Foundation provides funding that makes Andrew and I makes our work possible. It allows us to do this work of supporting schools. And then we also want to disclose we are co-investigators with the End of Life Nursing Education Consortium, meaning the LNEC, and we support schools. So very excited to do that work. Next slide. Oh, I think back one.
Sorry, what was that, Megan?
Can you go back a slide? Sorry, I think we skipped one. Oh, or maybe not. Okay, there was a slide in the middle. That's okay. I'm just going to set the scene. Maybe the picture is later. So again, these individuals joined us for our workshop this summer. We had over 119 faculty from across the country who joined us for a 2-day workshop in Portland. And the focus of the workshop was how do you teach palliative care to students in undergraduate and graduate programs? It was a great workshop. We always love doing that. Here's a little teaser. We're doing it again, but wait for the very end of the webinar and you'll find out more. But with that, I'm going to stop talking and I'm going to turn it over to our speakers for today to learn more about the great work that they're doing. And we're going to start with Karen Harden and her DNP student, Brittany, who are going to share with us the Heart of Healing, Empowering Student Nurses Through Palliative Care Education. Take it away.
Thank you, Megan. Brittany and I are very excited to be here. We're going to be talking about the work that we've been doing with threading palliative care through our undergraduate program. It is an evolving process. We're not trying to insert everything in all the years all at once, but we're doing it in a stepwise approach. So that's what I'm going to be sharing with today. Brittany Needs Wiki is a graduate student in the DNP program, and she's been working with me since last winter when she worked in the our palliative care elective, and she developed some end-of-life programming in that class that the students in the class said, this needs to go to all students in the entire program. So Brittany and I spent the summer working on what we would do to integrate more into the entire program, and she'll be sharing an exemplar when I'm done talking about the curriculum evolution. Brittany will share the exemplar, and the exciting thing about that is that we actually just did our simulation on Monday, so it's very, very fresh in our mind, and we're all very excited about what happened there on Monday with the simulation. So I'm a clinical associate professor at University of Michigan. I'm also the director of nursing education in sciences and med-surg. So in that role, I'm making sure that I make room for palliative care every step of the way. Right? Next slide. So this looks like it shifted slightly in transition, but that's okay. We can see it all. This was a little piece of what was on the poster in the summertime, but I just made it into a slide to highlight the curriculum changes. All of our changes are guided by the AACN essentials and the knowledge that in the 4 spheres of care, we do have hospice, palliative, and supportive care. And the fact that they're highlighting the importance of that, I think, is exciting for all of us. And in addition, we also use the CARES competencies, the 15 undergraduate statements, as a foundation for what we're doing throughout the years. So prior to around 2018 or so, maybe a little bit before that, in the senior year, we had one palliative care lecture at the senior level. And I think maybe they did some small things at the sophomore level, but nothing was coordinated and it was a little bit siloed. In addition, we started our Exploring Palliative Care elective, which is the oval on the bottom. We started that in 2019 and have been running that once a year in the winter time for that many years. So since last year, and we wanted to start with the freshman group, and I wanted to connect with whoever was going to be teaching this communication class at the freshman level, but then I became the teacher for the communication class at the freshman level. So I thought, okay, what a great opportunity to insert the first of our content. So for our freshmen last year, we did an introduction to palliative care, made sure that they understood the difference between palliative care and hospice. And then we also worked on communication skills, such as responding to emotion, active listening. We did the silence exercise from ALNEC, if you've ever done that, where one person has to speak for 4 minutes. And that was really well received. And we'll continue. It's obvious that we have to continue the foundation of the introduction as we go through each of these different levels. Currently, we're working on the sophomore content, which we're hoping to integrate in the winter of 26. And we're going to be doing it in the form of a case study on a simulation day. It's going to be a 2-hour case study. It's going to focus on non-pharm symptom management. It has not been developed yet. It's just under construction. So this will be the freshman class that had the palliative care content last year, getting the sophomore case study this year. The junior level pain management content has not been constructed or implemented at all. So I should probably gray out that arrow. And I don't even know if we have yet to decide whether we're gonna do pain management, because now I feel like we're integrating pain management in a couple of places. But then in the senior level, we are, I'll go to the bottom one first. In the complex care class, it's a palliative, we have a palliative care session that is how they manage palliative care in the ICU. They do patient case reviews. They talk about goals of care meeting. We have a specialist from the hospital side come and talk to the students about what those consults look like and how they're managing patients. Mostly the specialty service does manage end-of-life patients because those tend to be the most complex patients. So we don't get that balance of palliative care across the spectrum. And then the thing that we added this semester for the first time is the end-of-life symptom management and postmortem care simulation. And this is the exemplar that Brittany is going to talk about, and we're extremely excited about. It was very well received, and I won't take any of your thunder, Brittany. Let's go ahead and advance the slide, and you can start talking about that.
Thank you, Dr. Harden. Good afternoon, everybody. I'm Brittany. As Dr. Harden mentioned, I am a postmaster's DNP student, and it's an honor to be here with you and I'm so passionate about this. I was a hospice nurse before I became a nurse practitioner. So this is something that's very near and dear to my heart. I'd like to discuss, as Dr. Harden mentioned, our senior nursing student simulation that focuses on end-of-life symptom management and conducting postmortem care. How our simulation occurs at the School of Nursing at Michigan is the students have a pre-simulation activity to prep them mentally for the simulation. And so Dr. Harden and I curated this to where we wanted to give them just enough information to get them mentally prepared to go through this process. And so we created a demonstration video on how to conduct postmortem care, and they did a very brief pre-survey of 5 questions, just so we can gauge how comfortable they were with identifying end-of-life symptoms and conducting postmortem care at this level, because nursing students have various exposures to this content throughout their clinical trajectory. So then when they come into the simulation center, we huddle in one room, and our simulation was a 2-hour block. In the first hour, we went through 4 different scenes or scenarios where we had the students in groups manage end-of-life symptoms: pain management, pain escalation, opioid-induced constipation, terminal secretions. Knowing that we didn't give them a lot of pre-learning information, we did provide them with non-pharmacological and pharma intervention cards, so they would have a reference, because we didn't really want them to focus on the medications. We just wanted them to focus on the communication and the experience and the conversation and the assessment pieces. We didn't want them to get too overwhelmed with the medication aspects. On the 4th simulation scenario, I did inject the terminal secretion sound. And so the student had to hear that sound while also interacting with a bedside family member for our simulated patient. Her name was Mrs. B. And so that really that sound they've never heard before, some of them, so it was really impactful for them to hear how the terminal secretion sound does occur. Then we gave them a 3 to 5 minute break, and then we brought them back to our huddle area. And this is where Dr. Harden and I were really passionate. And this is what really separated us, I feel, from the masses. As the students were walking back in, because we had all the students leave the area, and then when they came back in, Dr. Harden greeted each student with the statement saying, Mrs. B has taken a turn and she appears to be like dying. So just giving them that mental kind of drop of their emotions. And then when they walked in, I had very somber music playing. So they all came and sat down. And then I walked them through the full minute of pronouncement, the full 60 seconds of look, listen, and feel. And I had a crying sound in the background as well, just so they can feel the tangible emotion associated with this, just so they knew that pronouncement is something that's certainly a part of the nursing scope of practice, depending on their institution. So I wanted them to feel that long 60 seconds. And then after we had them go through the minute, he had each student say the exact phrase, Miss B has died, because we wanted to drive home the point when somebody has died, using died, death, that is finite and that is clear and that's kind to the family, saying, I'm sorry, they're no longer with us, they have passed. That's not clear and that's not kind for the family in that moment. So we really wanted to get them out of their comfort zone and express this exact statement. Then we divided the students up and they conducted postmortem care on an adult mannequin and a pediatric infant mannequin. And so depending on the time, they would be able to do both. And so then we'd have them at the end of the 2-hour block, we'd have them do their own self-reflection in the sim center. And then they completed the same complete the same post survey, which is the same questions at the pre-survey. And if you go to the next slide, I can show you those results. So it's pretty incredible. So on the left side of the screen in blue, this was the pre-survey responses that we asked: how prepared do they feel for caring for a dying patient? And how prepared are they to recognize and respond to signs and symptoms of post-mortem of the active dying process? And you can see it's kind of all over the place. And then we had them answer the same questions after the simulation, and you can see a pretty stark improvement in their overall confidence and their ability of feeling prepared to manage these dying patients and also to recognize and manage these symptoms. After we had them do their own survey and their own reflection, we asked the students to go, we went around the room and asked the students if they can sum up this experience in one word, what would it be? And that is the bottom left word cloud of the students providing us with the one word for this whole experience. And a lot of it was really impactful. You know, they felt like this was a humbling experience and important, and it was very eye-opening and uncomfortable, but in a good way, because they'd never experienced this before. And I wanted to end with a quote from an actual student who said that this experience was, you know, really enjoyable, and she was really appreciative because we allowed her to have this platform to experience and practice this environment in this situation. And it helped her confidence, so that way she can feel more prepared to doing it in a real patient. And Dr. Harden and I really found that impactful, because the students coming in felt uncomfortable, but leaving, you can really feel the emotional response and how sacred this experience was for them. Dr. Harden?
Thank you so much, Brittany. So I just wanted to highlight the fact that the most amazing thing, and we had faculty members sitting in our class as well. The most amazing thing was the heavy emotion that we were able to create that really lent itself to a new and different experience for the students. So much so that we did have actually just a handful of a few students who did have to walk out, and we do give them the permission to leave anytime if they felt the need to. We allowed them to do that, and so one person left on Monday, one person left in the morning, and then the two people who really burst out crying during the super heavy emotional time, they stayed in the room crying, but yeah, it was tough. It was very tough, but an overall great experience, and we're so happy to be able to share it with all of you in this platform. Thank you.
Thank you.
Great. Well, thank you so much. And I put in the chat, but just in case anybody missed it, please hold your questions for the end. If you're afraid you're going to forget it, because there's so much great information coming your way, go ahead and drop that in the chat. And our speakers can be thinking about their responses, or just hang tight and we'll get to questions at the end. But thank you all. It's such a great work. We're thrilled to see, to hear, how impactful that's been for students. Our next speaker is Dr. Fortney, speaking about a branching narrative as an evidence-based learning strategy for graduate students enrolled in an introductory palliative and end-of-life care course. Dr. Fortney, the floor is yours.
All right, thank you so much. I'm really happy to be here and share this work that's been a labor of passion, I think, over the last several years. I am an associate professor at the Ohio State University College of Nursing, also our director for the undergraduate nursing research program, honors program. And I teach this introductory course as part of a graduate palliative and end-of-life care certificate program that we started. This is the third year of that program. Please advance the slide. Okay, so just to describe what our certificate program is like, we are bound by the university to a certain structure. There have to be 4 courses, 2 in the college that is hosting the certificate. So we have 2 in the College of Nursing, and then 2 courses have to come from other departments. The certificate must be able to be completed in 1 year, and it has to be delivered in an asynchronous online format. So it's sometimes challenging to teach this content in that way, because as Karen and Brittany shared, some of these topics can be pretty emotional for students. And so we've tried to build in assignments in this program, and especially in this introductory course, where we have frequent check-ins with students and we allow them time to do reflections, so that we can just really keep tabs on how they're feeling about this content. Please advance the slide. So this, back one. So branching narrative is an interactive learning tool that presents learners with scenarios that then require them to kind of move through that scenario and make decisions at key points. And then each choice leads to a new development or new information while helping students understand the outcomes of their decisions. And this approach has been particularly effective for teaching complex skills such as clinical reasoning, situational awareness, and soft skills like communication and conflict resolution. Next slide. So we used a branching scenario from a previous course as a base for this. That previous course was it was an online course as well. It was for RN to BSN students. And we had to update the information that would be relevant for interdisciplinary graduate students and clinicians so that it could provide for a little bit more of complex decision making and some opportunities for higher level thinking and reflection. Next slide. So what I did was over the course of about 6 weeks earlier this past summer, I worked with 2 instructional designers from our online office here at the university to expand that initial scenario to make it more at the level of a graduate student. And then we also developed a pediatric scenario because students were asking for additional scenarios. They had really liked working through that and wanted more scenarios. So we then went about planning this activity utilizing some decision paths that would expose students to a lot of different decisions that a patient might encounter or that their family might encounter. And then we tried to think of as many potential choices that a patient might make in that particular situation to then give students different paths to follow. We created a template kind of on paper, which was then transferred and built in a program called Twine. And we also tried to put in some scenario images and we used some AI generated through Adobe Express to help come up with those pictures. As you can see, the pictures are not exact matches, but they were close enough to where we could use them throughout the scenario process and kind of tied that all together. Next slide. So as far as the application, this is going to run for the first time in my course this fall. We're going to be doing it in a couple of weeks, and the students receive instructions on how to access the scenarios and complete the activity through our Canvas platform that's called Carmen. They're advised that these scenarios are intentionally complex, that they might be emotionally challenging. We try to set that all up ahead of time so that they're prepared for what they're going to see. And then we try to use some real world situations and let them practice supporting patient decisions that reflect patients' own goals, even if they might differ from what the student would choose for themselves. Next slide. So each case starts out by providing some relevant background information, and then as it goes through, there are some clearly defined decision points with options that the students can choose. So they can go down different pathways. They're prompted as they go along, and they can then observe the outcomes of the choice that they made. And we do encourage them to go back and complete the activity more than once so that they can explore all of those different patient decisions and the different outcomes. Next slide. Okay. So if I could share my screen. I wanted to go in and share with you, if I could, wanted you to see like exactly how this kind of works in our Carmen module. can you guys see Carmen Canvas? Okay.
Yes.
So this is what, oh, let me get rid of that. This is how it looks when the students first log in to Carmen. It gives them the introduction there, the objectives for the assignment, and then here are the directions. So when they log into this, there is a password for them, unfortunately. Okay, well, it may not let me in. This is not good. There we go. Okay, so they run the game, and this is what comes up. So we have our picture there. They get their initial information. This is an adult scenario where it's a 45-year-old married mother. She has no prior history of cancer, but there was a family history, and she has noticed some symptoms, and she is eventually diagnosed with cancer. And so then they want to know, what treatment she's going to pursue, and so what happens next. So she has some conversations, communication, and then will she or will she not pursue treatment? And she's young, she does want to pursue treatment. And so then it takes them then through what her goals might be, some initial interventions, what some follow-up might be. And then this would be the time that she could also be approached about advanced care planning. So it has them explore some things around advanced care planning. And then does she or does she not move forward with that at this time? Maybe she doesn't want to move forward with that. And then, an outcome of that is 3 months later, she begins to decline. And then, it sort of just keeps going through these things, what might be beneficial for us to help support them with during that time. Would they like to pursue these things or not? Yes. And then, it just kind of keeps going on. She does kind of pretty well, but then 2 years later, she's got some more decisions to make. And, she's experiencing new symptoms, some more decision points to make here. And she doesn't move forward with more treatment, so she's continuing hospice care. She considers advanced care planning and transitions to hospice, and then kind of what that looks like. We also then go into after the patient's passing, what might happen with their family and things that we can do with that. So then, of course, we are encouraging them to, go through the case as many times as possible. That'll take them back to the beginning, and then they can follow the different pathways, and they can choose different options as they go through the case again. Okay, so I will stop sharing. Okay, so then after they complete that branching narrative activity, then there's several post-case reflection questions that we ask students to respond to. And this will help process their thinking and their feelings while they have been completing the activity. And it allows them to consider decisions that adult and pediatric patients and their families might make, and sort of what their feelings were as they went down those certain pathways. Next slide. So some of our future plans, as I said, this is going to be utilized and evaluated in this course this semester. we're working on development of even more scenarios that's planned. And there was something I didn't put on this slide, but that I've been talking to some people about is that I would like for this to sort of evolve going forward, in that we're not so much feeding information to students, but actually letting them kind of come up with what they might do. A lot of these students are in school to become nurse practitioners, where they will, you know, have to be making those decisions and making those recommendations to families. So allowing them to practice at even a little bit higher level. The technology is out there, but not widely available yet. And there is kind of a high cost associated with that right now. But I'm hoping that, you know, over the next year or so, some of that might be able to become more available. That's what I'm hearing, at least. Also kind of looking into what AI platforms might be available for some of this. So more to come and more development. This is just sort of a starting place, but the students seem to really enjoy this activity. And so, you know, we're just trying to be responsive to their feedback and give them even more information as we move forward. I think that might have been my last slide. Oh, I wanted to just acknowledge a couple of people. Dr. Susan Thrain had developed the original adult branching scenario that she used in her RN to BSN class. And then our pediatric case was based on an article that had that pediatric case, and they went through that case in that article. So Alice Bass is a collaborator of mine, and so she helped with all of this. Okay, and any questions at any time, happy to take those. Thank you.
Thank you so much, Dr. Fortney. My gears are definitely turning with, oh, what can I do? I mean, what else could this look like? So yes, if you all have questions for Dr. Fortney, go ahead and put them in the chat or hold tight and we'll get to those at the end. And now I'm excited to have our third and final speaker. So I'm going to turn over to Joy, who's going to talk about her initiatives related to palliative and end-of-life care.
Thanks so much, Megan. So thank you for having me. I'm excited to be here. I was actually part of the workshop this past summer. So for any of you who are thinking about joining, do it. It was a wonderful experience, and I got to meet so many wonderful people, including the other presenters today. So it was nice to see both of them on here. So I'm going to be talking about the class that we offer. I am on faculty at the St. John Fisher University in Rochester, New York, which is in Western New York. And I also practice clinically as a pediatric and perinatal nurse practitioner in a community-based organization called Compassion Net, where we provide care to about 500 families in the upstate and Western New York region. And I work in the neonatal ICU as a nurse practitioner in addition to that. But in my role as faculty at our School of Nursing, I am the lead in our palliative and end-of-life care program. So I'm going to talk a little bit about the class and some of the innovative things that we've been doing in class. So Ryan, next slide. So the overview of the class that we provide is that it's a 2-credit, full semester long required course that is part of our first semester of our junior year. So at the beginning of our nursing program, we use LNEC as the backbone of the course. So all students are required to complete LNEC in process throughout the semester, depending on how it correlates with our schedule. Some of the class topics that we cover, a lot of them come from LNEC, and then there's a few extras that we include, but introduction to palliative care, communication, pain and symptom management. We do a full class on self-care and resilience and cultural considerations, grief, loss, and bereavement, a class on advanced care planning. And then we also talk about some of the more vulnerable populations in palliative care, such as those with developmental disabilities at end of life and how that may be unique, and also pediatric and perinatal palliative care. The next slide. So as Karen had mentioned, the AACN Essentials has emphasized the importance of providing opportunities for hands-on hospice and palliative care for our students. So I've heard from a lot of different schools of nursing that people are wondering, how do we provide this hands-on care? Because it's hard to find these clinical opportunities for our students. So that's one of the things that we have been able to focus on in this course. Next slide. So we're able to provide hands-on care for our students to be able to care for dying patients. And the way that we do that is through collaboration with comfort care homes in our region. So I do recognize that we are lucky to have quite a collection of comfort care or hospice homes in upstate New York. So this is a map showing upstate New York with Rochester right in the middle here. And each one of those red dots is one of the 16 comfort care homes that we partner with, that we send our students to throughout the semester. We have about 160 students per year. Yes, this course is undergraduate. 160 students per year. We have the larger cohort of students in the fall, about 120, and then about 40 to 60 students each spring. Every student is required to complete 16 hours of volunteer time within the comfort care homes. There we have about 6 to 8 students that are assigned to each comfort care home, working together in a group to establish their schedule and meet with the director and learn the specifics about the home that they're assigned to. And then throughout the semester long class, we do provide 3 weeks where the students are not required to meet in class as a gesture to allow them to fit these volunteer hours into their busy schedules. So overall, we've been able to provide about 2,000 hours per year of hospice volunteering to support our local region, which has been such a win-win for both our students and for the comfort care homes, who are almost always very desperate for volunteers. We've seen that the comfort care homes have actually really appreciated the energy that the students bring, the excitement that the hospice volunteers and the nurses have to be able to share some of their expertise and knowledge with the students. So they've really appreciated the opportunity to work with our students too. So some of the details about how this works. We do not have clinical instructors that are with the students at the comfort care homes because the students are participating as hospice volunteers. And the way that we have made that work is that this falls underneath the umbrella of the community engaged learning department within our university. So it is within the School of Nursing, but in collaboration with community engaged learning. The one caveat is that our students are not allowed to administer medication while they are volunteering for liability purposes, since there is not a clinical instructor there. A full orientation that most hospice volunteers would need is not needed for our students. Our students are required to complete the first 4 weeks of class before they're allowed to go and do volunteering, so they can learn some of the specifics about the basics of what is hospice and palliative care. They go through communication and pain and symptom management prior to showing up to volunteering. They're also required to watch an hour-long orientation video that we have created about the role of a hospice volunteer in comfort care homes. They also have to go and meet with their comfort care home director to have their own orientation, which usually lasts about an hour. And they do that as a group of 6 to 8. They go to the comfort care home and meet with them. Once they've completed all of those requirements, they can start their volunteering. They are required to complete 16 hours, and this is a requirement to pass the class. If they don't complete their 16 hours of volunteer time, then they won't pass. We are only allow 1 student at a time to go to these comfort care homes, because the comfort care homes are only allowed by law to have 2 residents or less. So we find that if there's more than 1 student, that they don't have enough to do. And we require that these 16 hours are broken up into 4 4-hour shifts, which really helps them to see the ongoing care of dying patients and the different stages of dying that they might see. So they may see someone who's doing really well and then be able to see the decline and then potentially be there for the time of death and postmortem care. So those 4 different 4-hour shifts is the way that we require them to break it up. Every week in class, we discuss their experiences. So we start out every class with about 15 to 30 minutes of debriefing. Let's talk about how your comfort care home volunteer shifts went. What did you see? What was interesting? My favorite thing is when they come to class and they say, Professor Hogan, we saw exactly what you said would happen. We saw it happen in real life, which always makes me so happy, because they're really taking the didactic portion of the class and they're really seeing it apply in real life. It also helps them to be much more engaged in class, because when I talk to them about things such as how to help support families who are struggling with providing opioid pain support to their loved ones, I say to them, you very well may show up to your comfort care home next week and have to deal with this very issue. So pay close attention to what I'm saying. They tend to be very engaged in class. They also are required to complete a discussion board after every shift. One of the things that makes this doable for the students is that they pay it forward, meaning these 16 hours of time that they do as volunteers in the comfort care homes will count towards their clinical hours that are required in their final semester when they do their community health nursing course. So that tends to make them a little bit less spicy about the fact that we're requiring them to do extra volunteer hours, because I always remind them that your future self will thank you for the time that you spend this semester working towards the clinical hours that will be banked for you. Next slide. This is a professionalism agreement that all the students are required to fill out on the very first week of class. So I just wanted to go through this just to give you an idea of how we set this up for them and what we talk through. So we actually go through this with them right at the beginning, and we go through every bullet point very clearly, so that if there are issues with professionalism, then we can refer back to the contract that the students have signed. So just emphasizing with them that the willingness that they need to show to help out in whatever is needed. There's really nothing that we have found that they are unable to do outside of giving medications, because these are not very high acuity settings with IV pumps and things that they might not be ready to use. They really can do just about everything. So they're providing a lot of comfort. They're sitting and having conversations. They're holding people's hands. They're giving bed baths. They're toileting. They're feeding. They're cleaning. All of those things. We emphasize the importance of a genuine sensitivity to end of life for them. Dress according to the expectations. We emphasize the importance of not using personal electronic devices, which I'm sure all of you appreciate that in our settings. We talk about the importance of communication. So this is really a good opportunity for them to learn professionalism as they learn to communicate with the partners that they're working with. So emphasizing the importance of professional emails, what should those look like, professional phone calls. And we also make it very clear that once they set up their schedules with the comfort care home directors, that their schedules should not be changed. This should be treated like a clinical time would be treated. A no call, no show is not acceptable. Making sure that you're not just not coming to your assigned shift. We talk about the importance of non-judgmental and respectful care for diverse populations, obviously HIPAA guidelines, and that they have to function within the parameters of the comfort care home outside of they cannot administer medications. And then we've had to emphasize, as we've learned over the semesters, that they cannot do volunteer time during other class time or clinical time or simulation time, because I've had some other professors say, your student told me that they can't come to class because they're going to volunteer at the comfort care home. So we've had to nip that in the bud. So thankfully we've got that. And then re-emphasizing with them that they cannot administer medications. So that is a lot of the details and operations of it, because when I presented this over the summer at the workshop, that's the thing that I found that people were really asking a lot about, was how do you make this work? So I gave you a lot of those details in case those same questions tend to come up. So that's all for me.
All right, thank you so much. So at this point, we will open the floor to questions. Yes, so by the way, here's everyone who joined our workshop this last summer. We can leave it on the screen while we have our Q&A session. Our speakers today, not Brittany. Brittany can come hopefully in the future, but our other speakers are in there somewhere. They know where they are, but they're amongst the group. But any questions? Okay, so there's a question about clinical assignments, Joy, for your activity.
So clinical assignments as in what they need to complete after they've done their volunteer shifts. I think this is what you're talking about. So everyone is required to complete a discussion board after every volunteer shift. And in addition to their discussion board, they're talking about their experience and what happened during their shift, and they're also answering a prompt. We have 4 prompts throughout the semester. How would you define a good death? What perspectives have changed over the course of the semester in regards to death and dying? What's one thing that happened that was difficult or awkward for you, those types of things. So they answer prompts in addition to the discussion boards. And I was able to set up the discussion board so that the students who are assigned to the same comfort care home are the ones who are interacting with each other in their discussion boards, which has been really helpful because as they're caring for the same residents and the residents progress towards death or die, they're able to process that and talk about what they saw so that they can not only learn from when they're there, but they can learn from when their other group mates are there caring for the same residents.
Other questions? You also can just raise, at this point, you can raise your hand and open your mic if you wanted to ask that way. While y'all are thinking of your questions, I have a question for Karen and Brittany. I'm gonna put y'all back in the hot seat. You mentioned that your son was, brought up some emotions for some students. I'm just sort of curious, since you've done it this time, you saw, I think you mentioned like 3 students in particular were quite affected by that. Would you do anything different, or do you have thoughts about, how that might shape the next iteration of your simulation? And if you haven't thought about it, that's okay. I'm just curious what your thoughts are on that.
I wouldn't do anything different because we're okay with those emotions, and I think that we do enough warning to and give them some options if it should occur for them. It was interesting, Brittany, and I'll let you weigh in too to see if you agree with me, but there was a 4th student actually who we learned about through a faculty member even before the simulation started a month or so ago. And she was very, very afraid to even attend. And so we ended up meeting with that student. Brittany and I met with the student together without their faculty member. And we ended up meeting with her for about an hour and a half to allow her to process the grief and loss that she was experiencing, to tell her what to expect in the simulation, and to even bring her down to the simulation center and walk her through the space, and give her a place where if something were to happen, this would be a room that she could go to and she had access to. And all of that turned out to make her feel very safe. I do believe, Brittany, she walked out at some point during that session, but she returned again, and she knew exactly when. Brittany had kind of explained when she might want to walk out. So I think she did at those particular times. Any thoughts, Brittany?
No, I agree, Dr. Harden. And I will say on Monday, 2 of the students started to get emotional because one of the questions that was posed was talking about a patient that's in the active dying process. The phenomenon of them holding on until their family member arrives to bedside. And Dr. Harden and I truly believe that in some situations, patients who are actively dying, when they hear that their loved one is coming to bedside, that they'll hold on. And so then I shared a story that occurred when I was on the inpatient hospice unit when I was working, and that really brought up a lot of the emotions. And so it was a really beautiful moment for them to just kind of hear and think of nursing in the most compassionate delivery possible. And I agree with Dr. Hart. I don't think I would change anything. We gave them trigger warnings, we gave them the safe space. And I also emailed the campus CAPS, which is the psychological, and I let them know on these 2 days, we're doing these simulations, here's what it entails. Just in case you get an influx, this is the why. And if you have any resources, let us know. And so we made sure that we had some emotional support brewing in case that really bubbled up too.
Let me tell you, we ran it 4 times each of those days, and because it was 2 hours and 2 sessions in the morning and 2 2-hour sessions in the afternoon. And at the end of this past Monday, I had seen it so many different times, but this one part that the listening and pronouncing, I was getting choked up myself. So, each group of students who arrived had a different energy of emotion. And sometimes it was heavier than others. And I found myself kind of sniffling in the background and not being able to really help it. Andra.
Hi, everybody. I just wanted to, I got on for other reasons in the middle of your presentations, but just listening to folks here, I'm reminded of the importance of faculty getting comfortable, if you will, and feeling ready for holding that kind of space with the students. And you just really put an exclamation point on that with your emotional response yourself, Dr. Harden. So
And we actually we invite all of the faculty to come with their students and sit in, especially because this is a new simulation. And not all the faculty took us up on it or were able to come, but the ones that were there looked at us and said, wow, you guys, this is amazing. So we felt really good about that. Yeah. And hopefully they're learning too, because they're going to be the ones that are in the clinical setting. Yeah.
exactly.
That's amazing. Thank you so much. Dr. Fortney, there's a question for you in the chat, I believe. Yes. Were there any survey results or student feedback data regarding the branching narrative? Any recommendation that students shared?
So we have not run this yet. It's going to go in a couple of weeks, but we did do a simpler version of this in previous courses that their feedback led to this expanded version. So I'm hopeful that this expanded version has addressed the feedback that we got on the prior version. And then, I'm hopeful that they're going to like this one even better. And, and of course, we're going to survey them and collect more feedback and see if we need to tweak anything even further. But yeah, this will continue to be an evolving sort of assignment for them, because we do want to make this something that they really value and see that they're growing from.
I was sort of trying to envision, as you were showing us through it, how big is this tree? Right? If you think about branches, is it you go down this path and then it branches from there, or do they kind of keep coming back to like the main lane, like for advanced care planning? Do they kind of route back to that part of it, or is it really just this like extending branches?
Yeah, it is extending branches. And I had done this on paper first, and it was pages and pages and pages of just all this different information and different ways that they could go. And then that instructional designer took all of those pages and put it into that program called Twine and made it come to life on the screen. So I was really just happy for their support to do that, because it was a lot of information.
I mean, if you had to guess, at all said and done, how many different screens were built?
Oh gosh. I probably had, 30 pieces of paper for each scenario, and there's a screen for at least each page, if not more. Yeah, they're big scenarios. So it'll take the students a while to go through that and then to process and answer those reflection questions. But that's all built into their time and an asynchronous sort of delivery. So I think it'll be time well spent for them, I hope, at least.
Well, and we hope you might share that huge resource. Once you get all the kinks worked out, or once you're happy with it, we'd love for other people to use that, because I'm just thinking, wow, the amount of work that went into that would be beautiful for me just to be able to pick up and use, as opposed to start from scratch. So,
yeah, absolutely.
Yeah, Barbara, you had your hand raised.
Yeah, I have a statement. My dissertation exploring nurses' perception of dignity during end-of-life care. And one thing was missing. There was no palliative care courses for the undergrad. Also, we only get bits and pieces of death and dying. And I think all universities should have a course related to palliative care. This is excellent. Thank you.
I know this is just my bias. I talk to my colleagues that like we have whole courses on OB and peds and there's a place for that. But when we talk about specialty, there's a specialty there. Everybody dies. I mean,
So
I'm just
true.
saying, I feel like we talk fundamentals here. Anyways, that's my bias.
Yeah,
But
I
I
love
own
it.
it.
Yes, I'm with you.
Ryan, can you go back to the slides again? We just have a few final slides as we come to the last little bit here. It's thinking. Okay, perfect. So as we come to close again, thank you to our speakers. These slides will be sent out, will be available when this goes on the faculty corner, and they include contact information. So if you wanted to follow up with any of our speakers, please reach out to them through email, ask for all, any other thoughts that you want to know, because they are really truly doing incredible work. And we encourage them to, once it's all out there and you get some data, we'd love to hear how it went as well. We have the rest of our fall series already scheduled, which we're very excited about. Our November webinar will be on November 9th. Dr. Carolyn Phillips, who was one of our faculty this summer, at our workshop, we had a session on storytelling through music as a way to process grief. And she's going to be sharing a bit more about that intervention and reporting back on what she learned from working with faculty at the workshop, because there's some really interesting faculty perspectives that came out from this world of grief that we found fascinating, and we thought y'all might too. So we encourage you to join us with that. And then in December, Dr. Tony Glover from Oakland University is going to be talking about how she has taught palliative care and online RN to BSN programs. This was a follow-up question from several individuals. So if you're teaching in online spaces, please join, because you might find some benefits from that. There was also a recent position statement that AACNS shared about how the spheres of care show up in RN to BSN programs, and we were very happy to see they said, yes, palliative care matters in these programs. So we've invited Dr. Glover to share more in that space. So please join us. And then one more slide. And if you are you're thinking, man, I missed out, I wanted to go to this workshop, don't worry, it's coming back. So this coming summer, July 16th and 17th, again, we're going to be at University of Portland because they take great care of us. It's a beautiful campus. We are having the workshop again. So applications for that will open up in January. So just be on the lookout for that. We will send out through our sort of LNET communications when those applications go live. Now that you've attended our webinar, if you haven't joined us before, you get added to the list that gets notified when those go live. But if you want to know more about the workshop, you can go to our LNEC Faculty Corner website. You can just type that straight into the search bar and it takes you straight to our website. And under upcoming events, we have a whole page about all things workshop. So if you're curious about what it covers, who qualifies, all those things, you can find out more now, but keep on the lookout for that. If you did attend, you can't come back for the same track. However, if you teach across programs and you wanted to learn about the other track, then you could apply for that as well, or invite a colleague from your school to attend instead. So with that, we want to thank you. Andrew, is there anything you want to say to close?
No, just we are really super excited to be able to host again next summer here on my campus. And it's just wonderful to see a lot of names here that I recognize, and we'll see you next month, hopefully.
Oh, everyone have a great, I know it's midterms, so survive the midterm craziness, and we will see y'all in November. Bye, everyone.